And now from a very good friend of mine to another very good friend of mine, who also just became my friend during COVID. And one of the perks, right? We always look at the silver linings. It's all of you amazing people that are now become family to me. I'm going to hand the floor over to Dr. Zandre Botha.
Thank you so much. It's when we come to a group like this, I always do feel this has become family, because most of our family have, taken the jab, and I just had such a horrible experience last week. My cousin, she's younger than me, she's 38. She had 2 heart attacks 2 months after taking the jab. The doctor, convinced her that it's because she's a little bit overweight. I mean, she's carried a few extra kilos for so many years. So all of a sudden it's because she's overweight. She's got stents put in. Her daughter's 5 years old. So it's very hard. And then I was on a call with Dr. David Martin as well, and people were saying, you're so brave, it's so wonderful. You've got so much courage. And I hear that as well. And I go, that goes without saying, we're just doing the right thing. I don't think of if I'm courageous or not. I mean, I had, the health professional council basically coming to threaten me and telling me it's political and people get gunned down for speaking out. But for me, it's really, keeping kindness and keeping love and saying, but I told you, you shouldn't have, and now it's not the doctor's concern that forced her or that did the jab. It becomes all of our problems, the people that are speaking out against it. And it should just keep our hearts guarded, because everything else flows from it. It's very true. So yeah, I am seeing a lot of people with side effects. A lot of them don't think it's because of the jab. They just think now all of a sudden they have issues and nobody else can figure it out. And then they come to me, and very much like what people have been, how we've been treating COVID as well. There's a lot of similarities, on that. People I'm seeing stuff in the blood before it manifests as symptoms, although I am seeing people who have had very bad effects and then they've come to me. But a lot of stuff I could have, I'm trying to prevent it from going into a stroke or going into a heart attack. So what I'm seeing in the blood is what they are picking up in a lot of, the other blood tests as well. White blood cells that are not responding, and they're non-viable. And then I also see these structures in the blood that is abnormal, these black like crystals. And obviously there's a lot of things that we have analyzed, and a lot of other scientists that have come out and analyzed these structures. So for me, my thought pattern was the following. It was, if there is chemicals or metals or things like that in the blood, how am I going to get that out? So the thing that's irritating the blood, that is causing all these other bad stuff in the blood, to how can I get out of it? Because my speciality is to look at causes and aggravations and these things that makes it worse. So I always go to not just handling side effects, but also to try and better my patients, the environment, and the environment that I look at is blood. And I always say life is in the gut and in the blood. If I can fix the gut and the blood, then I can help a lot of people. So I'm also dealing with a lot of autoimmune diseases. And interestingly enough, my patients last year when COVID hit, I didn't get any of my patients showing up with COVID, but their families or their spouses or things, because they were already on treatment and they didn't seem to get any side effects or even get the disease. So a lot of the patients that I treated, and again, just focus on basic things. One of the things, it's not on my protocol, but I want to mention this product. It's called AHCC. And this is a product that even when I get a sore throat, I take 2 of them. Half an hour later, I forgot that I was sick to start off with. But this is immunotherapy, and this is evidence-based nutritional immunotherapy. And I do use this for my cancer patients as well, and even for myself. So before I had ivermectin, this is what I used for all the COVID patients, and we didn't lose one patient. Okay, so initially, this is what I started to see in everybody that took the jab. Severe rouleau and stacking. There's no oxygen in these cells. And this is after the protocol, which I will discuss shortly. This patient was on the protocol for about 4 months. Then I tested again. So you can see there's a significant difference. We're not seeing that stacking anymore. There's still these kind of crystal-like structures that we're seeing, but it's not as severe as what it was before. This is also just, severe stacking and rouleau, lots of fibrin, which is pointing to liver, a compromised liver, and this was after. So the red blood cells are now not stacking anymore. They are much looser. They have started to regain some shape. This is, just similar. These were all different patients. And we can see the red blood, there's no white blood cells even in this sample here. We can't even see any of the neutrophils or eosinophils or basophils. But here we can see white blood cells are forming again, although these ones are called band cells. So they are immature. So they're not yet mature, but at least we are seeing some movement. And obviously the symptoms are also much, much less. This was also before treatment, and this was after treatment. So we're not seeing these strange structures, and the red blood cells are nice and loose again. And I think I've got one more. Let's just look at that. So also severe stacking. I see this very strange structure. And then this was after a few weeks of treatment. So my protocol is as follows. So the first thing, we need to give an anticoagulant. I can't do prescription medication because I'm an academic doctor. I'm not a medical doctor. So I have to rely on things that I know will help patients out of a natural perspective. So I have a product called thromboside. I don't want to talk about that because it gets compounded for my practice specifically. But curcumin, like a turmeric or garlic, is also helpful when it comes to to help with coagulants. Then I do give ivermectin. I do a low dose when they come in presenting symptoms as well. And this is for mild symptoms because each and every person has to be treated as an individual because it manifests differently. Some is cardiovascular, some is neurological, some is immunological, some, the nerves are severely damaged, and definitely everybody's blood looks the way I just showed you previously. Then I do NAC. I love glutathione. It's just quite expensive. And a lot of my patients, if you are going to do quite a bit of support, a good quality glutathione is quite expensive. I think we pay about 700 Rand a bottle. So the NAC does help as well because it's the precursor for glutathione. And I do, you can go up to 2,000 milligrams NAC a day. I do 500 milligrams 3 times a day. And then I do oxygen capsules. So it's a blood oxygenator. I always say you can go long without food and water, but oxygen is a couple of minutes. So I do try and get the oxygen levels up in the blood. Then I do a product called Hydro Shot, which is molecular hydrogen in pill form. And this is a therapy that is well known outside of South Africa, especially in the States. In Japan, they actually used molecular hydrogen instead of putting people on ventilators, they did the molecular hydrogen, and within 15 minutes, the patients were responding extremely well. So there was a lot of case studies that came out with that. I do it in my practice in any way. It's an anti-tumor, it's an anti-inflammatory, it's an anti-apoptosis, it's an anti-obesity, and there's no side effects. It doesn't create any other free radicals or oxidant. Then this product is very inexpensive, zeolite, because that detoxes chemicals, radiation, and metals. So zeolite will form like a type of a net that will run through the blood and kind of accumulates a lot of these metals and chemicals. And then I use therapies to support the organs of elimination, because no use in starting a detox, but you're not supporting the body as a whole. Otherwise, you're just pushing your patient into a crisis. I do recommend the colloidal silver, and recently discovered how awesome chlorine dioxide solution is. So I do recommend this to my patient if they still have this, cough or sinuses. It's quite wonderful for that. I must say I'm very impressed with this product. I also support with vitamin D because of the compromised immunity, or I will use the AHCC as well, because that is immunotherapy. There's quite a bit of acidity. When I test everybody's alkaline levels, the acid levels are extremely high. So I do an alkaline powder if this presents as well. And then I developed a product called my Miracle Booster, which is basically superfoods, your spirulina, moringa. There's also black seed in this. I also do betaine hydrochloric acid in this product, and I do a product called Barley Life, which is like barley grass, which there's a lot of studies that actually says it helps also with DNA repair. And then therapies that I focus on, and all these patients whose blood I showed, a lot of them, they were in here for therapy as well. When I just test patients with the supplements, there's a significant improvement, but the therapy really drives this whole thing for me, and we're seeing these wonderful results in the bloods when we add these therapies. And right on top of my list is the molecular hydrogen, which is administered through a nasal cannula. So it's also quite easy to use this. I just think, this also combined with IVs will just, helps a patient so much. Then I do ozone therapy. So if people have access to IVs, I don't. But ozone therapy is just wonderful. And patients that I've been just helping overseas that have contacted me, I always recommend ozone therapy, and most of the time they can get it in IV form. And they just get back to me and say, I feel like a new person. Thank you so much for recommending ozone therapy. Then I do something called Rive therapy, and the specific therapy I use on the Rive is called ATP DNA repair. This particularly saved my life because I get severe side effects from the shedding. It's just horrendous. But I must say, this is I'm always treating myself. I'll show you guys. I've got a mat, and like I'm sitting on it. It's connected to my Rive device, and I use it all the time because it's really, really helping me. And then we do camera laser therapy, especially if there is one of the patients I saw, they actually wanted to amputate her arm. I don't know why they wanted to do that, but there was a blood clot that was blocking the flow of blood to her arm, and I don't know why they just said let's amputate the arm. I don't know, but anyway, she came to me. I started her on my protocol. We ran her through the whole thing, and then we did the camera laser therapy specifically on that area where the blood, and we could actually see, the circulation returning. and it was so great that we could see improvement immediately. Improvement immediately of the symptoms as well. So yeah, that's what I've been busy with. Any questions?